Welcome to another edition of Car Crash Wednesday here on LinkedIn Live. I am standing remotely next to my friend and colleague, Dr. Armin Feldman. Hi,
Hi,
Armin.
everybody. Welcome to Car Crash Wednesday Live. We're happy to have you aboard.
This has been a really fun medium to share these redacted reports and our unique consulting services for personal injury and medical malpractice and workers' comp attorneys. And for anyone who's new to Car Crash Wednesdays, feel free to make a comment. We will be answering questions live on the show if you want to type comments. We will we're happy to share today's redacted report with anyone. If you want to email us, I'm going to pop that up here, and that is at comments@physicianshelpingattorneys.com. And today's report, Armin, and you can elaborate on this, is really a very, very typical type of case that our attorneys are receiving. And these reports, again, for anyone new, are being used in the settlement demand and negotiation portion for our personal injury attorneys with their insurance adjusters and with the opposing counsel. And these reports are anywhere from 5 to 15 pages, and we're going to go through a specific one today that only involves soft tissue injuries.
Great. And Mike, I think we would also be remiss because we've learned recently that not only is our audience a personal injury and workers' comp attorneys, but we've found that a lot of physicians are tuning in to Car Crash Wednesday Live, and they're also tuning into our podcast, physicianshelpingattorneys.com. So in addition to welcoming our attorney viewers, I'd also give a shout out to all of the physicians that are watching as well, and we welcome you and are happy to have you join us.
I'm really glad you brought that up. Let's jump into the case. Gotta love technology here. So I'm sharing my screen. Everyone can see this is a real report that has been redacted, names, identifying characteristics changed. This was unique in that the attorney said, my client is significantly injured. It's been some time now, over a year, and she's young. She used to be healthy and active, and she's just a completely different person. And I'm getting a lot of pushback from the insurance. They don't want to cover the medical bills, and they don't see that she has these ongoing injuries.
Right. And Mike, I would also say, I use this expression, but this case exemplifies two things. First, it's a bread and butter case because our attorney clients have just so many of these soft tissue injury cases where there isn't objective of evidence on an MRI or CT scan or ultrasound of a ruptured disc or a fractured bone or something like this. This is a very, very common case. And one of the things that our attorney clients are always facing is, how do we make sure that we include everything, that we maximize the case value in the settlement on a soft tissue case? Because what happens so often is exactly what you're describing. There's pushback. Oh, well, there isn't anything big going on. And we know, our attorney clients know, that in fact soft tissue injuries can be very significant in terms of just being an injury itself and in terms of functional losses. In fact, I was researching soft tissue injuries just the other day. I saw a firm, I forgot where in the United States, but they actually settled a soft tissue injury case for $315,000 recently. And I wanted to see actually if I could find out more about that case. But that's always something that our attorney clients are confronting, is how do you do best in these kinds of cases?
This woman was driving home from work early in the morning, and she was crashed into on the rear passenger side. Her car was totaled. She didn't have any head trauma or loss of consciousness, but she just remembers being really upset and immediately felt a headache. She got up the next day, she felt awful. She had soreness in her neck and back. So she went to the urgent care where she was diagnosed with neck strain and non-intractable headache. Pretty vague, but common complaints. 4 days later, she went to her chiropractor and they diagnosed and kind of documented. We're working with the medical records here as we're not treating doctors, that she had taut and tender neck muscles consistent with the mechanism of injury. She was seen twice a week, and lo and behold, her headaches got better. So again, these reports are facts. We're arming our attorneys with reliable, provable, information on the medical aspects of their cases. Then she went to her PCP about 8 days later, confirmed neck pain and low back pain, and said she had paraspinous muscle spasm. She was also, and this comes up later because this is a unique report in that, for a little bit of a spoiler alert, there's a new diagnosis that I made during my phone interview portion of the call with this client. And the PCP recommended a psychologic consult because of this new anxiety that seemed to be just completely brought on. So she continued to have back pain, neck stiffness, rating it a 7 out of 10 intensity. And it was then recommended she see a pain management specialist because it just wasn't getting better. So she was seen at this advanced pain center, and they did trigger point injections and called it myofascial pain syndrome. Funny enough, this case has layers. So about 6 months later, I forget when the initial month of her first accident was, but she was driving home on another highway, and she heard screeching brakes and a sudden crash from behind. Her car was pinned up against the cement median, and she was in a second car crash. And she had to physically climb out the window of her car.
That's traumatic in and of itself.
Oh, I know. And she said her neck got much worse after the second crash. So this is the portion of our reports where we jump into the ongoing medical problems. These, again, soft tissue. Her headache's resolved. She has neck pain, and I'll jump down. She has low back pain, and then the new mood disorder that we're going to talk about.
Right. Let me also jump in and just say myofascial pain syndrome is no small thing. We have both seen cases where this is a soft tissue injury, but the soft tissue injury causes a tremendous amount of pain. It causes a reduction in the activities of daily living. It can affect a person's ability to work. And the literature on this, there's no clear-cut description of who's going to be susceptible to myofascial pain syndrome. Although I did see one study of about 1,000 people, and they said women more than men, people over 65.
Yes.
But anybody can get myofascial pain syndrome. It's just one of these things that some subset of the population is susceptible to. And that's one of the things we need to spell out in our report.
And she is still using muscle relaxants daily. And this is a portion of the report where I included some peer-reviewed literature.
Great.
Where exposure, this paper was titled Exposure to Motor Vehicle Collision and Risk of Future Neck Pain. And this paper simply lays out exactly how neck injury in a motor vehicle collision doubles the risk for future neck pain, which just kind of played into me building this up as this wasn't something that should be just dismissed or thrown away as, this young healthy woman has neck pain, but it has no value or impact on her life. I believe there really is a functional loss here.
Yeah. And
so then I jumped into her low back pain. Again, she was a 26-year-old woman who used to lift weights, regularly exercise. Another nuance to this case, she had seen a chiropractor 2 years previously for about 6 months. She was treated for right-sided sciatic type pain. My attorney had reached some pushback whenever they brought up this low back pain, saying she already had back pain.
Right.
When I talked to her, completely different. And she said her sciatic type pain had completely resolved, and this new pain was completely different. And that's the course of injuries in someone's life. Just because someone had a headache when they were going through menstrual cycles doesn't mean that they can't have a post-concussive headache.
Right.
So
Yeah, this comes up so frequently that opposing counsel, opposing doctors, they're always looking for some kind of quote out, right?
Yep.
And so, oh, she had some sciatic nerve pain. Obviously, this is a pre-existing condition. And what you've been able to tease out here is, hey, what she had before is nothing like what she's having now. And that sciatic pain never returned. And there's a temporal relationship between being hit so hard that in the first accident, her car's totaled. Now, we're not accident reconstructionists or structural engineers, but we know enough that if the car is totaled, there was a lot of force involved.
Yep. And just like you laid out, her prior pain was at a different location of a different character and was unrelated to her complaints that were caused by the auto crash. So I wanted to lay out part of how her life is, and she's employed at 2 jobs. She works as a waitress and also as a clerk. And now she's asking, and this is where we get specific, because this is important that everyone understand the narrative about how this woman's life has changed. She now asks her other employees to get buckets of ice, and she's paying busboys out of her wage to lift chairs because it's her responsibility as a waitress to put chairs up at the end of the night and clean, and she's not able to do it.
Right.
I mean, it's sad. And she's unable to walk her dog because she's scared of him pulling her. And again, relating, she had a normal MRI back in June, but despite that normal MRI, I believe these soft tissue injuries are significant. She's been compliant. She's committed to recovery. She's demonstrated that. She tried and failed yoga, home exercise, stretching, physical therapy. And I pulled in another paper here because it specifically applied that the association between a rear end collision and future health complaints. This was a gem when I found it because it lays out with 4,000 subjects. Headaches were increased about 4 times. Thoracic pain went up 3 times. Low back pain about 2 times. In general ill health, 3.5 times with whenever a person experienced a motor vehicle crash versus one who didn't.
I see there's sleep disturbance on there too, which is such a common problem with myofascial pain syndrome that when the person lays down, the pain tends to increase.
And then truthfully, I don't believe it's medically possible to estimate if or when she'll become symptom-free or return to normal function. Now, I had hinted at a little bit of a spoiler on the uniqueness of this case, but it's happened before where in speaking to her, it became very clear that she was still shaken from these crashes. And this, a fair amount of time had passed. So she had said, I'm terrified. I get into my car and I start to freak out even now. I have dreams during the day when she's daydreaming and at night of getting into a wreck. She freaks out if she can't leave work before 3:30, her words, not mine, because she knows traffic's going to be worse, so she has to ask her boss to leave early. She even shared a story that she was out to dinner with her parents in the back seat. Her father had to swerve, it happens on a regular basis. She got so upset, her heart was racing. She got home and couldn't calm herself down for over 30 minutes. She just said no one could understand why I was so upset. And this happens a lot now. So I'm not a psychiatrist. I'm not a treating doctor here. So I assessed that she was never formally diagnosed with acute stress disorder or PTSD. So she needed to get help. She needed to be seen for this. A fair amount of time had passed, and she was having flashbacks. And there's even this vague hinting. Remember the PCP who said she should go see a psychotherapist? And she said about 1 month later, she saw a psychiatrist, and he said, I can't help you. you need to go see a trauma specialist because the medications I'm giving you won't help you. So
Yeah.
this has been hinted at and danced around. And so I included in the addendum of this report the DSM-5 criteria that symptomatically diagnose her with PTSD. And then jumping into one of our favorite parts of the report, our future medical care and costs. It's a segue because she's going to need to be evaluated for this, and not only this, but her other injuries.
So it's so common that we as medical consultants, medical legal consultants on legal cases can see something that hasn't been diagnosed yet. By the way, nice job on diagnosing that. You don't have to be a psychiatrist in order to be able to diagnose that. And one of the advantages that we have is that we probably are the only doctors that have that 30,000 foot view. So somebody is injured in a work-related accident or some other kind of traumatic PI situation, an auto crash, and then they go around from doctor to doctor, and each doctor is looking at their part of the elephant, right? Yeah. Nobody is seeing the entire elephant in the room. And in this case, Mike, you were able to tease out a very significant damage in this case, which is this woman developed a psychiatric condition. She had major symptoms. It was affecting her life. It was affecting her quality of life, her ability in her everyday actions and living. And you were able to see this where no one else was able to quite pick it up.
And in this future medical care and costs, I go back to her ongoing neck and low back pain. Pretty plainly should be treated by her PCP and chiropractor. She can expect to have additional courses of physical therapy. I also believe acupuncture, medical massage, and a gym membership were not yet, those options were not yet exhausted and could help her. She has the advantage of being 27 years old, which our older attorney clients maybe don't have some of that luxury to improve her physical conditions. She's going to need a repeat MRI of her neck and lumbar spine. I do believe her strength and function will improve with treatment, effort, and time, and she seemed committed. She's going to need ongoing psychiatric care to assess her PTSD. And then I felt it was important to explain this EMDR therapy because given that she experienced PTSD and was still suffering from this, this has really been the mainstay of the best current treatment for PTSD. And that has a cost associated with it.
Right.
She was going to continue psychotherapy sessions with her therapist. All of the physicians will variously prescribe medications, testing, and imaging. And then unique to this case, I don't have many where the attorney asked me to apportion part of the injuries to the first crash and the second crash because of the way the insurance companies and the opposing counsels were involved. So I used the best of my ability as a medical opinion in speaking to her and looking at the conditions of the crash and made this apportionment 70-30 on the musculoskeletal pain and limitations, and then 30-70 on the mood disorder PTSD, because I really believe the second the crash was more traumatic, climbing out of the window, and it came on the back of a other recent crash. And I really think that was more responsible for her mood disorder, as she was now feeling like she had a target on her back.
Right. So I hope I'm not just stating the obvious here, but this myofascial pain syndrome, it's not aches and pains. This is an actual medical condition with significant symptoms. And what you were able to do, Mike, is provide evidence for this, in that there is a whole body of literature that we can turn to, help our attorney clients to be able to rely on as evidence to prove up this particular medical damage in the case.
Exactly. It's amazing to be able to do that. And the final section here, well, I did include an addendum on the DSM-5. This is down here that highlights, you could go through and check off these these criteria. And pretty much anyone could actually do it. It's just knowing that the DSM-5 exists. The estimated future costs of these expenses of this medical care, the expense of this medical care, turned out with, we always include these charts that we believe are very reasonable. They are geographically specific. And her total from these soft tissue injuries was a very conservative $46,000 whenever I got to the end of it. And you can see how these things add up. It's $5,000 for a chiropractor, Armin. That's not an absurd number.
Right.
I mean, oftentimes it's double or quadruple that by the time someone gets done with their treatments. Wouldn't you agree?
Right.
So
Right.
honestly, this probably could have been more, but I take it pretty personally that I want to be able to back these up. And her injuries were significant to her, but this wasn't a $1 million case in the way that we know these cases go.
Right, but it was a significant case. Let me throw in one kind of off the wall thing here. So EMDR is currently the gold standard for the treatment of PTSD, but I'm sure that viewers, both attorneys and physicians who are watching, know that on the cutting edge forefront now for PTSD is guided psychotherapy with some kind of hallucinogen like ketamine or psilocybin.
Yes.
Now, this is still, some doctors would say it's not even experimental anymore, but this is still experimental. But who knows, in the near future, maybe it'll be EMDR or guided psychotherapy with one of these hallucinogens that are being studied and are showing such great promise to treat PTSD.
Yeah, great point. Well, this episode today, I mean, we're just past 20 minutes. It's important to us. We know everyone's time is valuable. We would welcome any and all feedback. Like I said, if you want to see this report, I'll be happy to send you the redacted version of it or any others with neck pain, back pain, nerve injury. Just email us at comments@physicianshelpingattorneys.com. And like Armin mentioned at the beginning, tune into our podcast. You can find that at www.physicianshelpingattorneys.com, where we have over 10 episodes already. And you can also listen to it on your iTunes podcast, your Google Play, iHeartRadio, wherever you listen to podcasts, we're there. And Armin, I can't remember if I told you or not, but we posted our last week's podcast episode, which is a little more casual than what we do here on Car Crash Wednesday, because we do talk about cases, but we often talk about some of the background of our other consulting work. We had over 40 listens in the first 24 hours of our last podcast episode, which is exciting.
Yeah. So actually we'll be recording episode 15 tomorrow. So we're very excited about that. Also, let me throw in, if you have a case that you would like to run by us, please send us an email at comments@physicianshelpingattorneys.com. We'll get back to you by phone. We're happy to discuss any of your current cases as well.
Fantastic. Everyone have a great day.